about a conference which is exciting. We just had a joint conversation about one that she'll mention in her presentation, but our conference, our Music Care Conference, is coming up in October 27th in Ottawa, which is fantastic. And our lead partner is the University of Ottawa Music and Health, as well as Carleton University. And so we also have a masterclass actually coming up soon, which is on music, art, and storytelling. For those of you interested in our Music Care Standard Training, on April 27th and 28th, we have a level 1 coming up, so pass that along. On May 25th and 26th, we have a level 2, which talks about the 5 domains. And we have a level 3, actually our level 3s are finishing up for this season. And starting again, we have another cohort on September 7th. And we have just released today, actually, an online virtual learning studio, Intercultural Dynamics in Music Care, with Erin Lightstone, talking about things like cultural humility and how to reach people in care. And this is our masterclass. So Catherine Patricia Cobbler will guide students through the multidisciplinary workshop, drawing correlations between music and painting while listening to different pieces. Played by Catherine with her viola and loop pedaling using modern techniques. Students will paint landscapes and reflect on people, places, and images that inspire them to tell life stories. So leaning into a little bit of a treat for our May masterclass on storytelling. And so here I welcome you and introduce you to Dr. Kate Mulligan, who is going to actually talk to us about the basics of social prescription in Canada, meaning sort of an overview at a high level, because this is, for our community, the first time we've offered this. So welcome, Dr. Kate Mulligan.
Thank you, Dawn, and thanks everybody for being here. I am happy to be with this lovely, intimate group on a beautiful day. And yeah, I'm going to talk about social prescribing in Canada and the work we're doing through the Canadian Institute for Social Prescribing. And I'll try to make some links to the role of music in care and in social prescribing along the way. Since we are a nice small group, please don't hesitate to just unmute and interrupt me or pop a comment into the chat box as we go. And otherwise, I'll just keep going ahead with my presentation. So I'm going to pull up my screen. And I keep pressing chat by mistake instead.
Yes, okay. And as she's pulling up her screen, that's right. Thank you for that, Kate. We will help moderate conversations. So welcome to take questions through, and we'll monitor the chat, as well as we want to thank the George Moonen Foundation for their support, which is why we can offer this free of charge. And this will be recorded for future viewing.
Okay, thank you. For some reason, my screen decided it didn't want to work for a second, but I think it should work now. Can you see it?
All good.
Okay, good. Okay, so here I am, and here you are. And yes, I'm Kate. And I wanted to acknowledge and recognize that the land that I'm on today here in Toronto is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It's covered by Treaty 13 in the Williams Treaties, and of course is now home to many diverse First Nations, Inuit, and Métis people. So I acknowledge this is where I am. I continue to do the work I need to do as a treaty person, and I encourage all of us to do the same, and also just to connect for a moment with the land under your own feet. Where I am today, it's a beautiful spring day. And I'm grateful to hear the birds and feel the sun and be part of planet Earth. So thank you for being indoors with me on this moment. And I hope you will get a chance also to celebrate the beautiful weather and the turning of the seasons. Just to give a little bit of the context around social prescribing, this is stuff that most of you know, that the vast majority of our health and well-being is not determined by our genes or even our access to healthcare, but the other parts of our lives, the income we have, our early childhood development, our exposure to racism and discrimination, our housing circumstances, and so on. 50% or more is the conditions of daily living. But we haven't caught up with that yet in healthcare, and we need to do more to really address the things that really do make us sick and the things that really do make us well. We sometimes call these the social determinants of health, which includes access to quality healthcare and culturally safe ways, but also things like our social and community context, our sense of belonging, our economic stability, our neighborhoods, and so on. And these are just a few examples, right? And we know that even underpinning these social determinants of health are more structural determinants of health, the causes of the causes, that explain sort of why we're born into certain circumstances that constrain our ability to have good health and well-being. If we do the work of trying to create more of a sense of community belonging and address those social determinants of health, we see increases in all kinds of other healthy behaviors and health outcomes. So if we feel like we belong, if we feel like we matter, this is an important social determinant of health, right up there with income and housing and some of those more material ones that some people might be more familiar with. We even do things like eat healthier, report better mental health, get physically active more, stop smoking, all those kinds of things. So there's a nice virtuous circle that happens when we center the importance of belonging. And that's the work that we try to do through what we call social prescribing, which is really a way to use your visit with a healthcare worker as one of a few potential doorways to access to community supports and social services, formal and informal, that can help address those social determinants of health. So everything from finances and housing through to social support, volunteering, and I think what is of interest to you folks is artistic activities, exposure to music and the arts and well-being. These are all things for which we have really good evidence that they can really help improve our health. So here's one example, Soup and Symphony at the Guelph Community Health Center in partnership with the Guelph Symphony Orchestra. So bringing together nutritious food, social interaction, and music all toward better health and well-being. Something that can be quite informal, but quite healing for everyone, and the kind of reimagining of what health and well-being and healthcare can look like. There have been a number of really good evidence reviews about the importance of the arts in social prescribing and in improving health and well-being more generally. And one of the most important ones is this one by Daisy Fancourt and Saoirse Finn for the WHO's Europe region. And they found important links to the role of the arts in a few different areas. So one of them is health promotion and the prevention of chronic diseases. So exposure to the arts, whether as a participant or as a viewer, and different levels of engagement can do things like affect the other social determinants of health, support child development, encourage health promoting behaviors and prevent ill health, and support caregiving, which is something that you know a lot about. The evidence also supports that it can help us in managing and treating existing health conditions. So if you're already experiencing mental illness, if you're supporting or providing care for people with acute conditions, for people with neurodevelopmental and neurological disorders, non-communicable diseases, and end-of-life care. So again, they conducted a significant review of the evidence showing that there are a number of different kinds of components of exposure to the arts that can be helpful for our health, things like aesthetic engagement, emotional evocation, stimulation of our cognitive resources, our brains, physical activity, dance, movement, social interaction, you name it. There are a number of different types of responses that our bodies show when we are engaged in music. So we have psychological responses, we have embodied responses, social ones, and behavioral ones. We do things differently when we're around music. So, and that can lead to different kinds of outcomes that can help us with health promotion, prevention, management, and treatment. I encourage you to have a look at this body of evidence if you are interested in knowing more about how it works. What are the mechanisms by which music can help our health and well-being? But also, if you need to cite the evidence to help convince other people about the value of this work, this is a really good resource. So here are just a couple of other examples out of their research that they found, for example, that people who attend cultural programs at least once a month are 48% less likely to develop depression. 48%. this is incredible. This is more significant than some pharmaceutical interventions and other kinds of interventions. New mothers participating in a singing group can reduce their symptoms of postpartum depression by 40%. And again, this is a huge number. And as a mom myself who had twins, I think I really would have benefited from participating in a singing group at that time in my life, and I still would now. So it's really quite staggering when you look at the size of the effects of some of these interventions. So, one of the things that we're trying to do in this work is, sorry, I think I missed, yeah, there we go. Physical health. Older adults who participate in community arts events, like even just occasionally going to the theater or a museum or a gallery, are 20% less likely to even develop a physical disability, and they show a 25% reduction in chronic pain. So again, even a small amount of interaction with arts can be really healthy for our overall well-being, prevention, and promotion. So one of the things that makes social prescribing special and something different from just care coordination, which is just providing the resources to people, is that we're moving away from doing things to people or at people. We're not even just doing it for people. We're doing things with people, and ideally the people themselves are leading the way. So the work is being done by the participants, so like the patient or the caregiver, the person, right? We don't tend to use patient language in social prescribing, but and the person who would benefit from participating in the arts or other social interventions takes the lead in the conversation, focusing on what's strong in their lives over what's wrong. Trying to shift the conversation away from what's the matter with me to what matters to me. And in social prescribing, we try to provide the right amount of supports and services to help that person take the lead and get access to the kinds of things that they think are most important to them, most interesting to them, they're most likely to stick with over time, and all those kinds of things. So that focus on the empowerment of the person, kind of tapping back into their own strengths and capacities, is really important. And at the systems level, this helps us do something that healthcare people are interested in, which is advance what they call the quintuple aim for healthcare improvement. It can improve population health, right? There's evidence that it's going to make us healthier overall. It'll enhance the care experience for people. And there's good evidence that it improves care team well-being too. So again, rediscovering that sense of purpose, deformalizing, debureaucratizing some of the work for healthcare providers and other practitioners, bringing music into their lives and workplaces, bringing a sense of relationship and purpose again is also meaningful for them. It can reduce costs by moving people to more appropriate and effective upstream interventions and relieve pressure on the healthcare system when people, so for example, if you're going to see your primary care practitioner and the issue is loneliness rather than something more clinical, you can be connected to a service that is more affordable and reduces costs for everyone, but is also better for you and more what you need. And of course, we can use it to advance health equity. So we can be very purposeful in making sure that the people who need this most have access to it, that we're focused on priority groups who are facing the biggest barriers to health and well-being or the biggest gaps in health outcomes. So to make sure that the work we're doing is culturally safe. And so Dawn had mentioned, for example, that training around making sure culturally appropriate music is provided and that you can do that in a way that's safe for the person and really centers their experience. Those are the things that we need to do to really advance health equity. So I'm going to pause speaking for a moment and just share a very short video from the UK, who have been the global leaders in social prescribing. They have this implemented more at the systems level. So across the National Health Service, there are link workers whose job it is to really listen to people, help them have that conversation, connect them to supports and services. And then they connect to activities like this one, which is a dementia choir. So let me know if anything is not working here. Otherwise, I'm going to try this video right here.
We all know how important it is to support people with long-term health conditions with their well-being. And I'm here today to see one of the rehearsals for our dementia choir, which is doing just that. And it's also a great example of social prescribing in action. So Karen, can you tell us a little bit about our dementia choir?
So our dementia choir originally set up by the BBC and Vicky McClure, but changed to a charity probably a year ago to give people who are living with dementia, their carers, their families, a safe space to come and enjoy, sing. Live music brings everybody alive.
So what do you think the power of music is for people living with long-term health conditions?
It's just amazing, and it's a lovely atmosphere. We uplift each other.
I actually start feeling better about things like a day or two before one of these sessions, and it goes on for a day or two after the sessions finish. You know, it's really quite staggering.
What have you noticed in terms of the benefits of the choir for your mum?
She absolutely loves it, if I'm honest. She really, and it's helped me, Laura and Katie, I think. We're meeting a family with the dementia choir, and everybody's in the same boat, and they are so welcoming, and we can all share things with each other.
So Kate, you are a social prescribing link worker. Tell us about your role.
We're there to give an holistic approach for people, to support them and guide them into what is out there for them. We're based in GP practices, but we'll connect up with whoever we can out in the community and other places to help people.
You've actually referred a few people into the choir in your role. Seeing them today and listening to them sing, what do you think the impact of music and being in this group has been for them?
It's just lovely to see some of them today, how they've blossomed, come into the choir, and just to see their smiling faces, and to see that they're chatting with others, and they're living well with dementia, which is what it's all about.
So what would you say to someone who's thinking about getting involved in an activity like a community choir, for example, for their health and well-being?
You need to just do it. It's amazing. It'll change your life, and you will make friends. People need to know about everything that's out there. I love it, and I know my mum is just loving it too.
Just go and do it. Just go and try it. Get a social prescriber to actually signpost you to something that's relevant to you.
You'd be surprised how much you'll enjoy it and how you integrate with people. It's helped me live my life.
What do you think life would be like without the choir?
I can't bear thinking about it. I love the dementia choir. It brings me joy, great joy.
I don't think Mick would be here today if it wasn't for the choir. His eyes light up. You know, I get Mick's eyes back, not the dementia eyes.
Thank you for joining me for that amazing video from the National Academy for Social Prescribing in the UK. I'm happy to pause there if there are any questions, and if not, I will continue on. Okay, I'll keep going. Do stop me if you need me to. So here's a little bit about what it looks like, how it works. This graphic comes from the World Health Organization in their Western Pacific region, who put this one together. It shows just one example of a pathway that social prescribing could take. So, for example, Auntie here goes to see her primary healthcare provider, who helps assess her needs, and may see that there's a social need that isn't really well provided for in clinical healthcare. So can make a referral to somebody who's called a link worker or a community connector, or a well-being coordinator, whose job it is to really sit down and spend that time and listen. To work with the person to develop a personalized wellness plan, so something that is meaningful to Auntie that she really wants to follow through on. And then they can make a further referral to appropriate community-based services. And they can, you know, it says here, counsels patient using behavior change techniques, and really that it really just means, you know, can help support them to take more control over their health and well-being, to remind them that they have a purpose, that that everyone, no matter what our capacities are, no matter what our medical and social circumstances are, we all have something to offer, and to help remind us of that. So, and where necessary, that link worker can also be the one who really helps the person take those first steps, which are the hardest ones. If you've ever been in that kind of circumstance where you feel stuck, or you're not feeling well, or you're feeling marginalized or lonely or left out, it's really, really hard to take the first step and go to a service. So maybe the link worker will go with you for the first couple of times, or help you to make a friend, or do other things that support you to really follow through. Then there is, of course, the social prescription itself, sort of the actual activity, individual or group activities or services, or maybe a range or a combination of things. And one of the things, again, that makes social prescribing so special is that there is some follow-up. So the primary healthcare provider and the link worker, they learn about, did this work for you? What is the impact on your health and well-being? What is the impact on your use of health services and other services? So that we can start to get a sense overall about whether this is working, how it's working, for whom, under what circumstances, and in what way are all those little initiatives and activities in the community and voluntary sector adding up to more than the sum of their parts. If we start to aggregate our learning across all of this, what can we say about the power of the community and voluntary sector, the power of music and caregiving, to improve health and to support our health systems? And we're doing that work. You are already doing this work, but it might not be well represented or recognized by people working in health systems. So this is how we can start to help measure and capture and tell that story back to the system in a good way. So social prescribing can be used for things like basic needs, food, income, housing, and so on. It can be used for social supports and mental health, prevention, or management and treatment. And then it can be used for that broader well-being around, and that's one of the places where arts and well-being, where arts and health interventions can really help. Although, as we've seen from the evidence, they help across the spectrum of those kinds of supports and services, and can be used in complementary ways alongside other interventions, other supports. At the system scale, there are some really important principles that we try to follow in social prescribing. One of them is that the community leads. So small organizations, individual patients and caregivers, the community sector. There is a lot of expertise, a lot of capacity in this sector, but not necessarily a lot of resources and not necessarily a lot of recognition of that expertise, and not in a sustainable and sustained way. So we want to foreground and support that community leadership and make it a bigger part of healthcare. Collaboration. We don't want to be competing for scarce funding. We want to help people work together and find ways to complement one another's work and work together and share what we've got to help advance everybody's health and well-being. Learning, I think I've mentioned that, trying to build in just even a little bit of evaluation and learning so that we can help tell our story better and improve the work that we do. And yeah, so those are some of the collaboration principles. Now I'm going to share another video, another couple of videos from the Canadian context about someone who has been received a social prescription. So first I'm going to show you a little clip from a play you may have heard of. It's called The Kink in My Hair by Trey Anthony. This particular version is from Calgary. And so I'm going to play just a little bit of a song from there, and then I'm going to play a little bit of a video about somebody who received a referral to go see a Toronto production of the same play. So I'm just going to mute myself and I'll play the clip.
I'm telling you, the hair, it sends me a message. Some of the things the hair tells me makes me want to laugh. And some of the things the hair tells me, I don't even want to know. Because some of us are hurting real bad. And as women, we cry a lot. Cry on the inside, too proud to cry on the outside. And some of the things the hair tells me makes me want to cry. And sometimes I do. But some of the things I hear, I keep it up here, right here in my head, right here in my ear. The things I hear is right here in my ear. What am I gonna do with this hair? Twist it, dread it, braid it, thread it, cry it, dye it, my hair. What am I gonna do? What am I gonna do? What am I gonna do with this hair?
Sorry, just trying to find my unmute button there for a second. I'm going to just move to a little clip from Breakfast Television where there was someone here in Toronto where I live who was referred to see the play. And so let me just, sorry, I just got to minimize my stuff here so I can get to it. And I'm going to play this one, and you can hear from Victoria, who was prescribed this experience.
Yeah. Victoria, now you have actually taken part in one of these social prescribing efforts. Tell me about what it was, what you were prescribed, and how did it impact you?
Well, what I was prescribed was a good social event, some time to spend with my black community, and also just a good time to just enjoy the day with my mother, because I did also get to go with my mother. Honestly, the whole thing was it was amazing. The play itself was a very light but also heavy play at the same time. Like, I say that because it did have a lot, it had a lot of meaning to it, but they didn't put a whole bunch of harsh information in there. Like, it was very well put out. Like, you know, it talks about gun violence between all the black kids. It talks about how black mothers are and how they feel, how they react, how all that affects them after. And it also addressed a little bit about in the Jamaican culture, it's a thing where parents get married, and then you know, I don't want to talk too much about it because it can be a little bit of a trigger to some people, but when the white man comes in and takes over the family and brings over the Jamaican family over, and what happens within all that. Like, they talked a little bit about that as well. When I first heard about the play, I thought I was going to talk about the curls in my hair. Like, you know, I know my hair is curly and naughty and nappy, but when I actually got in there, I learned it was more about actually talking about what we go through. Like, why is our hair so curly? Why is it so kinky?
Right, and this is the play, to be clear, is The Kink in My Hair by Trey Anthony, a play that was brought back to Toronto last fall. It's an incredible play if you ever get a chance to see it. But as you said, it hits home. And how did that impact you? Watching that play and seeing some of those issues play out on stage, how did that impact you and the issue that you were initially looking to fix?
Well, it was like an emotional roller coaster, because there was a little bit of laughter in there. There was a little bit of laughter in there. There was also some parts where you were like, oh, that's a little sad. There was a little parts where you were like, I can't believe that would actually happen to someone. Like, what? That's crazy. But for me, it was just it was good to get out, because I don't really leave my house very much. I'm a very calm and quiet person. So going out, it really just gave me some time to just be like, wow. This is really what goes on in my city. Like, a lot of these stuff I don't know about. I didn't know there was this nice theater where I could go watch this play. I didn't know there was the nice restaurant where they serve jerk chicken to make the plate look nice.
Right? Yeah. It's there, and it's all about access to it. And lastly, Albesa,
so I'll stop the video there. You can Google it on Breakfast Television if you want. But let me just put my video back on here. There I am. And I'll go back to sharing my screen, and then I'm going to talk a little bit about that particular experience, but I just want to make sure I can pull this up properly here. There we go. So, I mean, I really love that clip because it also shows, I think both of those clips, the Dementia Choir and the Kink in My Hair, show that both participating directly in music and being in the audience are both really powerful experiences for people. So participating as a carer, participating as a family member, participating as a person or patient can have those really important health and well-being benefits for us. And you can see in Victoria's story the way that it affected her emotionally. It brought together things like getting out of the house, having social interaction, feeling culturally part of the Black community, connecting to family with her mom, you know, having a range of emotional and physical experiences, and even connecting to things like food, right? So there is a range of different types of impacts that the music on prescription can really have for us. And I realized that I'm for some reason back to the beginning slide. So let me just pull up, let me get back to where we were. No, I don't, there. sorry about that. Sometimes when I go out of my screen, there we go. That brings us to the Canadian Institute for Social Prescribing, which has been around for almost a year now. And what we're trying to do is be a focal point for good work happening on social prescribing right across the country. Some people might not be calling what they do social prescribing. Some of you are probably doing this work and maybe giving it another name. So what we want to do is surface good practices, help people connect to one another, and help us build more of a network or more of a system around it so that we are doing it in an intentional way where we can keep learning and growing this work and supporting it in the way that it should be supported. So at the moment, we're an intersectoral collaboration anchored by the Canadian Red Cross with partnership from lots of different community organizations, funding from the Public Health Agency of Canada, and growing interest from healthcare, community sector, research, you name it, as well as organizations representing and having expertise in working with specific communities. So for example, EGAL works with LGBTQ and 2S plus communities. The Black Health Alliance works with Black communities across the country, and March of Dimes and Ability Center work with people living with disability and so on. And we have the Canadian Centre for Caregivers Excellence, who I think, yeah, there they are, they're on the slide. So quite a number of different organizations and always open to growing our collaborations. We try to include voices from social prescribing from all different types of sectors and all parts of the country. So healthcare providers, link workers, community partners. We have a participant advisory council, so people who have lived experience of experiencing social prescribing as a participant or who would benefit from social prescribing are right in there involved with helping us co-design what we think social prescribing could and should be across the country. And it has been a meaningful experience for those people who try it out. So, for example, we had a physician participant from BC say at the beginning of COVID, I was struggling personally, and so was our family medicine team. People had these huge needs that we didn't seem to be able to help. After we got started with social prescribing, we saw we could make a difference, and I found joy in my work again. This is the kind of change that we are excited to see and happy to see as people try this work out. There are a few principles, again, and I think I've mentioned many of them, and they're really rooted in what we call self-determination by people and communities as something. So we don't want to just create a whole bunch of supports around people that aren't sustainable when we take them away. We want to remind people of their own power and capacity to take more ownership over their own health and the conditions for their own health, which is Health Promotion 101. And then this isn't the same thing as downloading all the responsibility to individual people and communities to figure it out. We need to provide the supports and services around people, but we also need to do it in a way that helps them remember that they have that capacity and that exercising that capacity is really healthy. So some of the key principles are autonomy, so that ability for people to make their own decisions about what's right for them in their care. Competence, a reminder that, again, no matter who we are, we can do things. When we see the impacts of making our own decisions and doing things out in the world, making art, experiencing art, that reminds us of our sense of competence. Relatedness, that sense of belonging and mattering in our communities. And beneficence, which is a really big word that just means our ability to give back. And we see huge improvements in health and well-being for people who go on to become volunteers and help others, or, in any small way throughout their participation in social prescribing are able to get that sense of giving back. And again, no matter what our abilities are, no matter what our mitigating circumstances are, we all do have that capacity to make decisions, to show our competence, to feel we belong, and to give back to other people. Social prescribing is really starting to grow around the world. So we're part of the Global Social Prescribing Alliance. And in fact, I'm going to New York on Friday to talk about social prescribing developments in the US. And it continues to grow in many countries, and it's really exciting to see that. So I expect that it's not going to go away. You'll probably keep hearing more and more about social prescribing in your work over time. And here's another quote that I really like from somebody who was a participant. I was lonely before I became a community health champion. Now I help others with this great prescription out of putting life back into our lives. Oh, and I just wanted to put a shout out there for this upcoming event. I'm not involved with it directly, but you might be interested in it, about Music and Health Research Institute Music on Prescription Summit, which is in May. And Dawn let me know that Music Care by Room 217 has a relationship with some researchers who have been involved in this kind of work, and will be doing some future work together and conferencey type stuff in this fall. So stay tuned for that. I'm going to stop there, and that's all I have in terms of slides, and I'm really happy to just open it up and have a conversation and to learn from you about all the great work that you're doing.
Wonderful. Thank you so much for your presentation. I feel like my head is full of lots of information. We'll open it up to people that want to bring forward a question. You can either take your, turn your camera on and ask a question directly, or if you don't feel comfortable, put one in the chat. Go for it, Carrie.
Thanks. Kate, so many questions. Okay, I feel like, this is a big system that's looking to shift and change, and we've got some good evidence in Canada. And as I saw in a couple of webinars a few weeks ago, we've got some great practices and evidence starting to emerge here. For me, I just kind of go, isn't this like logical, right? That, being connected, yeah. Right? So, but I bought into it, and I use it and I practice it. And so I love it when some of my coaching clients, when I prescribe to them, pick up your violin that you haven't touched in 15 years, and they reach out a few years later and go, I'm so glad, because it creates this beautiful harmony for them. And anyways, so my question is, this is, emerging in Canada. CISP has been around since last year. Happy anniversary when it comes. And how could someone with a social marketing and a coaching background who uses these kind of, I'll call them willy-nilly, just intuitively, either participate and contribute in, or maybe use them more intentionally?
So great question, Carrie. And it's really nice to meet you kind of more
Really
in
nice
person.
Yeah,
I feel like we
really.
know each other from social media, and I can see
Yeah.
a few other names I recognize from social media here. So thanks for coming, everybody. Means a lot to me. I think there are a couple of different scales in which we can engage in social prescribing. I think one of them is like what you're doing, which is just trying to do this work in your practice. So people, those of you who are working, you are social workers, you are psychologists, you are caregivers, you are neighbors, you are civic, members of our society. Any door should be the right door for social prescribing. So maybe this is something you can recognize that you need in your own life and try to take steps toward making it happen. I know that's something that I have to keep reminding myself of, like, don't work too hard. Make sure you're doing some of these other things that are good for your health and well-being. But like everybody, I need support to actually follow through on some of those things. But you can, you can be referring people like you're already doing, Carrie. And then in the more systematic part is the part that I happen to be really interested in, which is like building this into our systems in a way that's more sustainable, that involves that learning and networking and so on. And that's where you need to be reaching out to partners and maybe starting with people in your community. Maybe there are folks doing music care type initiatives where you are. And so maybe that's one place to start. So, or maybe you need to be reaching out to your local community health center, family health team, family practitioner, hospital. Is there a place where you can make a connection with a healthcare or social service? Maybe it's 211 in your community, which is, like a telephone or online service that can help people connect. Maybe you want to put yourself out there and say, I want to be listed here so people can find me. So I think starting to reach out and build those relationships, even if it's very locally, is a really good place to start. And then when people are starting to do social prescribing in that more intentional way, one of the first steps they take is what we call community asset mapping. They look around at what's available in the community and they make a list, and they try to stitch that network together in an even stronger way so we can start really building strong connections. We can track referrals across these different organizations. We can start to see the benefits, and it just grows from there. And so that's kind of a long way of saying, like, whatever you think your next step might be, that's your next step. Do that one thing. And then, we'll keep going. And the beauty of social prescribing is that there's such a positive feedback loop that the more we do it, the more we like it, the more we want to keep going with it. And so we don't need to change everybody's hearts and minds right away. So if people are thinking in a much more clinical mindset, or they feel like, healthcare is an emergency, I don't have time for things that are too fluffy, we just try it and we show people we do it. And this was our experience in researching social prescribing, where, some clinicians, I think, were not sure that this really was within their scope of practice. And they just tried it out. And, over a short period of time, 6 to 9 months, they started to feel, yes, it's in my scope of practice. I can see that it's reducing people's unnecessary visits. It's improving their health and well-being. It's making me feel better at work. We didn't have to convince people of that. We just had to give them enough of a tool to try it out for themselves. And again, it's that autonomy, it's that competence, that sense of purpose, even for the practitioners ourselves. So so those are some suggestions about how to get started. And then I think the other thing is stay engaged with, webinars like these or events happening through CISP, so you can continue building your network of other interested people. And we're going to do what we can to help support those early adopters, like everybody who's here today, to help us figure it out as we go.
Thank you.
Thanks for that. I do, based on the information sort of piece, Kate, is there any way, I know you've brought up a few, but are there any places where we can find more of this research, or where we can read or hear or look for webinars?
Yes. Okay. So our website is socialprescribing.ca. So that's a good place to start. We have a few backgrounders. They're not all music specific. They're more generally about social prescribing. And then there is another place where I'm actually going to look it up while I'm talking to you and try and put it into the chat box. The National Academy for Social Prescribing, who did that one video that I shared from the UK, have a great evidence webpage. So I'm looking it up while I'm talking to you. Social prescribing evidence. Here we go. And I'm going to put that. They have some really fantastic evidence briefs that they've pulled together. And there is one on arts, culture, and creativity, for example, as well as lots of other ones. So I'm going to put it in here. You can check that out for yourselves. I'm involved in quite a few research initiatives right now, and we'll be having some research and evaluation results available within the next year or so from our first pieces of work around social prescribing here in Canada. And if you want to look into the academic evidence, you can, you can sort of search around social prescribing in Canada. We'll have, I'm guest editing an edition of Health Promotion and Chronic Disease Prevention in Canada, which is an academic journal that's put out by the Public Health Agency of Canada. So it's not just for academics, it's for people doing public health practice and funders and decision makers and really sort of pragmatic minded folks. And so we'll be putting out a special issue all about social prescribing in the fall. So you can look to that as well to kind of get the latest and greatest from the Canadian perspective.
Wonderful. Thanks for the link. I see them coming up in the chat. Anybody else have a question before I jump in? I don't want to take other people's opportunities. That's all. It's more of a just a brief historical. You mentioned the connections to the UK. Do you know how long historically, like how long has that conversation been happening there?
So, like social prescribing isn't a brand new idea. So it's been happening like since the dawn of time in all our communities. Like we know taking care of one another and doing all these kind of, singing together and dancing together and being in community and eating well. And we already know all this is good for us. So that's been forever. The actual terminology around social prescribing per se and the connections to the health system, they probably been going on for about 20 years in the UK, but more intensively in the last 5 to 10. And it's really only in the last 3 or 4 years that they've had this big investment in making sure that there's a link worker for every primary care network across the NHS. So it's still fairly new there. I think before that big investment in the National Health Service, they were where we are, which is that there are some really great leaders and early adopters doing it in certain parts of the country, but it wasn't widespread. Now it's widespread there. And so we're only just a few years behind, I think, in terms of making it widespread here. there's a lot of interest. So I hear, every time I do an event like this, or we get social prescribing out into the news, I hear from people who work in health systems or want to fund community organizations or want to start implementing where they are. And so it's definitely not going back in the bottle. Like I said, I think it's going to keep growing and you'll hear more about it. And like I said, ideally in a systematic way. So we're not too far behind, and we are part of these global communities where we learn from one another. And we've seen, so for example, in Singapore, they were kind of where we are, and now they are already doing social prescribing in a pretty big way through one of their hospital systems, very much focused on older adults, but they're like training link workers. They're focusing on people who are living in community housing, and they're leaping ahead of the rest of us because they've made it a priority. So really, it's just a matter of trying to make it a priority here too. That's what I'm trying to do.
Andrea, do you have a question? Yes.
I do. Hi, Kate. Thank you very much. Very informative. I am just looking to transition, and really am fascinated by this area of social prescribing. But I'm just wondering, how does one get into the area? Like, I'd like to become like a link worker and get involved in that capacity. I just feel it's like so meaningful to be able to give back to the community and to the people. But it's like, how do I, like, what's the entry?
Yeah, great question. Great question. So we, because we don't have it in a formal way here in Canada, there's not really one answer to that just yet. But we are just about to embark on a big project at CISP that's all about capacity building and training. Yeah. And so, for example, at the end of this month, I'll be doing the first ever graduate course about social prescribing. And I think Elizabeth is going to be part of that course.
Oh, can I be part of it?
And then we will be, over the next 2 or 3 years, building curriculum and training for workplaces and volunteers and so on. So that's all in development now. That said, the World Health Organization has some fantastic existing resources. So I will try to see if I can put it in the chat in a minute when after we're talking, but they have a training course.
Oh, they do?
For link workers. That's like an online thing you can do, and it's free.
I was looking
and they have I forget what it's called, but like a guidebook type thing that also helps people get started with social prescribing. And that one came from conversations with us. So April C1 Lee, who was really spearheading that particular project, she's a graduate of the Dalla Lana School of Public Health at U of T, and now works in Manila in the Philippines, but brought some social prescribing thinking alongside because she happened to come to a webinar like this and wanted to do stuff. So that's kind of how this is all happening. So I would recommend having a look at the training, reaching out to somebody near you who might be doing something that's similar to social prescribing, even if they're calling it something different, and starting from there. Yeah. I wish I had something more concrete, but we're just not quite there yet.
No, I mean, that's great. Actually, it's funny because I actually went on to the NHS and tried to get part of some of their training, but because you're Canadian, you can't get it. So the WHO is a good resource, because I'd like to, it's like I need to build up some sort of capacity, but I want to keep my toes in this area. And it's like, how do you do that? So we have a Southern Georgian Bay Community Health Center here.
Yes, and they do social prescribing, and they work with 2-on-1.
Really?
Yes, so they would definitely be the right place to reach out.
Okay.
For you. They could give you some advice about how to get started. Thank you, Carrie, for putting the toolkit in there. I popped in the Open WHO training resource as well. And like I said, through the Red Cross and CISP, we will be building all that stuff. So anyone who follows me on social media, we're hiring right now to grow our work. And this is one of the areas where we're going to grow, is in curriculum development and training and events and things. And so we'll start to have things like conferences and that sort of thing, but we're just really new. So we're still just figuring it out as we go.
Hey, you can only do what you can do. So that's great. Okay. Thank you so much for at least giving me a starting place.
I'm glad you're interested, Andrea. That's fantastic.
Yeah.
Elizabeth, I think you wanted to.
Yeah. And just listening to it and the excitement for myself as well, hearing about and learning about it. And this was a few years back, and I'm like, oh, this is new. Okay. how is it different from, you know, referrals that would normally be made? And, you know, and as a social worker, I'm like, oh, it's totally different. Yes. Okay. I get it now. And so trying to build that awareness even with our team. You know, we're developing an integrated model. Well, we have developed it and implementing it, an integrated model within our services and our service structure to look differently. And so as I'm introducing this, and everyone still scratches their heads and says, oh my God, this is so exciting. But how do you explain it a little bit more? And so, you know, having these opportunities and reaching out to, oh my goodness, I think it was Sonia from the community of practice. So being part of that and learning from others and connecting. And it's kind of like, you know, the spider's web. So you're like crawling here, learning from everyone and connecting, right? Really reaching out. And definitely, you know, Andrea, you hit the nail on the head. How do you learn more? How do you get access to it? So most definitely the WHO I would have recommended as well, which it's pretty neat. I haven't completed it, but it's pretty neat and it's really easy. It helps break down, although this presentation was very quick and easy, that it really makes sense and it clarifies everything, that you can really use these tools to help explain to others. I'm almost going to lose my thought. Oh yes, the part of the reason why I put my hand up is one of the things that I've been working on is so, you know, we take on students on several locations. And so although you want to provide them that, you know, the social work practicum experience, one of the things that that I'm working towards is building in the role of a link worker, the role of this social prescription within that that experience. So that's where I'm really excited to continue connecting, to continue learning. So like that's another way to help build capacity and explore and expand, you know, beyond the therapeutic lens, but also a social lens, which is really important.
That's awesome. That makes me really happy, Elizabeth. I think that, you know, it is very similar to what social workers do. It's very similar to what recreation therapists do, occupational therapists, or any number of different sort of health professions and voluntary roles and so on that do similar work, which is why I think it's important that the link worker is not a registered health profession. It's more important that it's, you know, somebody who really gets the community and understands the social context and can listen. Those kinds of skills, no matter what people's training is, are the most important. But we do also want to build on and learn from the amazing practice that is happening. So you know, in some ways it's not that different from what social work is, but hopefully we're able to communicate it and think about it in a way that's just had enough of a cognitive shift to help us build the relationships and as you said, really address the social. And recognize the social determinants of our health and well-being. And, you know, in mental health conversations, for example, this is becoming more important, recognizing that it's not just us having individual pathologies, but like we live in a context and we got to deal with that context and kind of try to do a bit of that upstream action and support individuals at the same time.
Andrea, did you have another question?
I have lots of questions. That was my major one, is like, where do you get started? Just sort of put your foot in the door sort of thing. And I think that's probably was well answered.
We also have, as Elizabeth mentioned, Andrea, we have communities of practice and communities of interest through the Canadian Institute for Social Prescribing. So, you know, if you want to connect with other people who are getting started to implement social prescribing or are interested on one of the components that, you know, being a clinician, being a volunteer, and so on, we have these ongoing conversations amongst these different groups that we support. So that might be another way to kind of keep your toe into finding out the latest and what's going on and meet other people and that kind of thing.
Yeah. Okay, great. Actually, I did listen to one, I think, the other day, which was like,
oh, fantastic.
Yeah. So it's like I'm like a sponge for all of this.
Yes.
And there's a question in the chat, I think, is Dr. Sina, who created the long-term care national standards, aware of the work? And if so, in what way is he helping spread the word and getting the federal government on board?
Yeah, great question. So yeah, I mean, he is, and he's also a key advisor for the Canadian Red Cross. And so, we should reach out again and have that conversation to see, to leverage his expertise and his networks. And I think we're ready for those conversations now about really trying to get more of that government investment on board. I think in the last year, we've been really focused on making sure that community leadership and community organizations and equity and collaboration are really at the forefront. We didn't want the train to leave the station from kind of mainstream health systems using the terms of social prescribing, but in a way that might cause further harm or just rebrand existing work or that kind of thing. So we wanted to kind of get our act together as community organizations. And I think we've been successful in doing that over the last year. And now we're going to head into, okay, we're ready to have those big conversations about funding this in bigger ways. And as I said, foundations are starting to find us or find partners to do, like, because we don't really implement, at the Canadian Institute, we don't implement social prescribing, but we support people to implement. So funders are finding people to support. Governments are taking an interest. We're having conversations with different provinces and federal departments. So it is all happening. And yeah, if you know people who know people, let me know. I'll lean on them too.
Wonderful. On that, I really want to thank you for joining us on the conversation today. And just for those of you that may want to refer to this in the future, we do have it on our website under Learn, under webinars. So you can go back if you want to catch something again or share it with your networks so that they can enjoy it further. It will be up on the website in a few more days, maybe in 4 or 5 days. And also, if there's anybody on the call that needs community CEU hours, we do give certificates for our webinar series. So you can email info@musiccare.ca to get the CEO to receive a certificate for the training hours. So again, thank you so much. And we hope to have you back as things move forward.
Thank you so much for inviting me. And thanks everyone for taking the time out of your day on this beautiful afternoon to be together. I really hope that we can keep the conversations going.